Hello everyone and welcome to another day of high yield USMLE questions. Today we will be talking about cardiology. So we have a 2-month-old girl presented to the emergency department with excessive sweating and pallor associated with feeding. So it's mainly with feeding. Probably the patient is exerting and that is causing the patient to have excessive sweating and pallor. Normally this shouldn't happen. This patient has it, so there should be some abnormality. Now, there is no history of fever or blue discoloration of the skin, which means there is no cyanosis. There is no fever, so which means that probably this is not infection related. There is no history of any prior medical conditions, and the patient takes no medication. Vitally, the patient is stable except for tachypnea. Examination shows hollow systolic murmur at the left sternal border. That's a significant finding. Now, lung examination shows crackles at the bases. Those who are preparing for USMLE Step 2 CK should know that hollow systolic murmur is always a pathologic murmur. There is always most of the time something wrong. And if you see this, the next step should be to do echocardiogram. Now let's see. So lung examination shows crackles, which means that there is pulmonary edema, probably. So which of the following is the most likely? Which of the following is the cause of this patient's symptoms? Now, so we have different options here. But first we need to describe what is going on here. So left hollow systolic murmur in an infant suggests that most probably this patient has VSD. Always think about VSD first. So let's say this is the 4-chamber heart. This is the right atrium. This is the right ventricle. This is the left atrium. This is the left ventricle. There's no membrane between the right and left ventricle. Now, what's going to happen here is that after birth, your left ventricular pressures are very high. So from the left ventricle, the blood is going to go here. Now, from the right ventricle, the blood is going to go through the pulmonary artery, and return here towards the left atrium. So you have increased flow through the pulmonary circulation, and then increased flow coming back to the left atrium, then increased flow coming back to the left ventricle, and then going back to the right ventricle. So this is the circulation that is going on. So you will have increased pressure, increased fluid here in the left atrium, increased blood here in the left atrium, increased pressure, increased fluid here in the left ventricle, increased fluid, increased pressure in the right ventricle. Also, eventually in the pulmonary artery, you will have increased flow and increased pressure that can lead to pulmonary hypertension. Now, over time, what's going to happen is that the pressure in the pulmonary circulation becomes so high that it leads to pulmonary hypertension. Now, that pulmonary hypertension is going to be transmitted into the right ventricle. Now, the right ventricle eventually will have so much pressure that it's going to cause the shunt to reverse from left ventricle to the right ventricle from the right ventricle to the left ventricle. Now, the shunt becomes reversed because of the increased pressure in the right ventricle, because of the pulmonary arterial hypertension, and that is going to cause right to left shunt. This is then going to go here, and it is going to cause cyanosis. So cyanosis, which because it occurs because now the blood is not flowing through the pulmonary circulation, it's not getting oxygenated. So cyanosis occurs. The second thing is clubbing. So remember, whenever you see clubbing just means that it's either a heart or a lung issue. Can also be GI issues like celiac disease, but mainly it's the lung or a heart issue. So here it can cause clubbing. So this shunt reversal occurs years after VSD. But remember, ASD can also cause it because it also causes pulmonary overcirculation. From the left atrium, the blood is going to the right atrium, and then into the right ventricle, and then into the pulmonary circulation, and over time resulting in Eisenmenger syndrome. This is called Eisenmenger syndrome, occurs with ASD, VSD, and it occurs years after. This patient has no history of cyanosis, nothing, and it's only 2-month-old girl, which means that we are not thinking Eisenmenger syndrome. So, but this is VSD, and the patient's symptoms are related to exertion, which is feeding, that is causing more exertion on the left ventricle, and that is causing more contraction, increased flow to the pulmonary circulation, causing crackles. That is VSD. Let's see what is the cause of this patient's symptoms. Now, the first choice is concentric hypertrophy of the left ventricle. So remember, this is not concentric hypertrophy, rather this is eccentric hypertrophy of the left ventricle going on here. Now, eccentric hypertrophy occur because of volume overload. And here we know this is the volume overload going on. The blood is returning into the left atrium and then into the left ventricle. So this is eccentric, not concentric. Concentric occurs when there is increased pressure on the left ventricle to empty blood. For example, hypertension, systemic hypertension can cause left ventricular hypertrophy, which will be concentric. Here, this is eccentric. Wrong answer, the first one. Decreased contractility of the left ventricle. The left ventricle contractility actually does not decrease here. As you put more blood into the left ventricle contractility remains the same. It's just that it expands, causing eccentric hypertrophy, and adjusts to the new pressure that is occurring in this patient. The next option is excessive blood flow through the lungs. That is the right answer. And it should make sense to you because most of the blood is returning from the pulmonary circulation into the left atrium and then into the left ventricle. And from the left ventricle, it is going back into the right ventricle and into the pulmonary circulation, causing excessive blood flow. Less blood is actually going to the aorta, and more is going to the pulmonary circulation because aorta is a high pressure system, and pulmonary artery and the right ventricle is a low pressure system. So the left ventricle will only pump the blood through the least resistance pathway, which is the right ventricle and the pulmonary artery. So excessive blood flow to the lung is the right answer. This is causing the crackles, this is causing the tachypnea, and all the symptoms that this patient is exhibiting. Increased resistance to the left ventricular emptying. Left ventricular emptying, actually the resistance has decreased because, like we talked, there is now less resistance to actually empty the blood from the left ventricle. It is a least resistant pathway, the right ventricle and pulmonary artery, so it will prefer this least resistant pathway. So there is actually decreased resistance. This is also a wrong answer. Hope this video was helpful, and if you like the content, you can subscribe to the channel, like the channel. Also, if anyone requires tutoring, I have been tutoring for over 3 years. They can email me here. Thank you for watching.